So good evening guys. If I'm visible and audible, give me a thumbs up so that I can just see that. I can't see the images, the messages actually. Actually, I just can't see the messages. I'm just unable to see the messages. I wanted to take it in the form of a poll, but I just can't see the messages. Oh yeah. Just give me a second. Let me just start with the session, guys. I just can't see anyone's messages. Somehow or the other, I'm unable to see anyone's live messages. So I can just discuss things out. Okay. I just don't know. I'm unable to see anyone's messages. I can see the likes, by the way. I can see the likes, but I'm just not getting to see anyone's messages here, so that because I was thinking of taking it in the form of a poll. Somehow or the other, I'm unable to see that. Let me just see once, otherwise I'll start with the session, guys. We'll just discuss, I'll give you the answers and then we'll have a discussion then. Okay. So yes, I can see everyone's likes, but I can't see anyone's message. That is the problem, which I'm trying to see on the phone, because this is exactly what we hold the class for. Anyways, let me start with the session without wasting any time. I can't see anyone's messages, guys. I can see myself in the video. I can see everything that I'm doing, but I just can't see everyone's messages. So let me think as if I'm being relayed live, and let me start with the session without wasting any more time. Somehow or the other, I'll not be able to take it in the form of poll because I just can't see messages. Okay. So even if I'm changing the phone, I just can't see the messages. Let me try into another phone once again, if I may. And then we'll just start. Just give me a second. Okay, so let's start without wasting any more time. Even if I'm unable to connect with all of you, if I can't see the messages, thank you for all the likes. I can just see the likes which I'm getting on the video itself, in the live video, but I can't see anyone's messages, guys. I can't see anyone's message in front of me right now. I just can't. I don't know why. Okay, the live settings which were there, somehow or the other I'm unable to get in contact with any one of you, or what you people are messaging, I just can't see. Okay, so sorry for that. So we'll not be able to hold it in the form of poll, but I will just go ahead with the MCQ discussions that we have today. So just beginning the session and introducing myself to you for the people who don't know me. A lot of you already know me. So for the people who don't know me, my name is Dr. Vinish Srivastava. Presently, I'm the head of the department and associate director of anesthesia and critical care. I'm working with the Fortis Lafam Hospital in New Delhi. Before this, I worked as a senior consultant here itself at the Fortis Lafam Hospital for the last 8 years. Prior to that, I was at Maulana Azad Medical College. I've done my senior residency from Maulana Azad Medical College, and I was also a specialist over there. Prior to that, I was at Deen Dayal Upadhyay Government Hospital, New Delhi. I've done my DNB secondary anesthesia from there. Before that, I've done my DA and FCPS. That's from Grant Medical College, Mumbai. That's in anesthesia. Before that, I've done my respiratory medicine. I'm also a qualified chest physician. I've done that from Lokmanya Tilak Municipal Medical College, Sion Hospital, Mumbai. Before that, I've done my hospital administration, and before that, I've done my MBBS. So that was a slight introduction about myself. And as in every class, I tell all the students also, apart from doing the clinical duties and the studies, have some hobby to de-stress yourself. For me, it's playing the guitar. All right. Also, I've been teaching students preparing for postgraduate medical entrance exams and FMG exams for the last 10 years. Now I'm associated with Unacademy, guys. So people who haven't followed me up, please do follow. Thank you for all the dedications, guys. Okay. So by following, you come to know when my next sessions are being held. That's the most important thing. As I said, the biggest problem point which you are seeing on YouTube right now is I can't see any of the live messages that you people are sending it to me. I can see all the people who have joined into the session, but I can't receive anyone's message. So the best thing, guys, is please download the Unacademy app. All right. You need a code to log in. Any code that you have can be used, or you can use Vinish Live, which is my name as a code, or anything that you have. The point is download the app. It becomes much more easy over there. As soon as you download the app, you have to open it. You get 3 things there: the plus, the free courses, and special classes. Plus is where we hold the subscription based. But people who are already prepared, remember, special classes are the ones which are completely free, where we take MCQs. I'm going to take another session tomorrow also, maybe for an hour and a half, which I'm going to take tomorrow. So we'll have the same MCQ discussion. And perhaps this problem will not be there which I'm facing on YouTube right now, that I can't see anyone's messages and I can't take it in the form of poll. So once we have our own app, guys, it becomes much more easy. So even the special classes, what we can do there is on the special class, take MCQs and we take it in the form of poll. I get all your messages and we can discuss it. Right now, I can't see anyone's message. I just can't see anyone's message. I can just see all the likes that you people have given me on the video. Apart from that, I can't see anything. Okay. So the point was to tell you about how the app works. So the plus is where the subscription takes place. Special is where the free classes are there. So this is where we normally discuss all the MCQs and the discussions which are there for people who have already prepared. Plus is for people who are preparing long term. Okay. So special class, which I told you, is completely free. All right. Where we discuss most of MCQs is just interactive like a plus class or a subscription based. The polls are held just like a plus class. Same thing, raise a hand feature, never miss a class, lecture notes, anytime, anywhere. So what is the difference between the subscription based, all right, and the one which is free? The difference is in the free, the time allotted to us, what we get is normally less. So we can just discuss MCQs over there because that is how the app is made up. And subscription based is where you discuss the complete courses. All right. So that's how we've divided them up. This is where we do most of MCQ discussions, and this is where we do the full courses. Okay. That's how it works. All right. So plus and the special. So as I said, people who are already prepared can just go through the free sessions of special class where we discuss MCQs. People who are still preparing should ideally opt for subscription based. All right, which is like is of 2 types. A subscription based is where you're getting both live and recorded classes from what we're teaching. You get to take part in the tests and quizzes. You get the question bank which is there, and you can study on the device of your choice. Another thing in the plus I said is another thing which is available is Iconic, which is Unacademy and Prep Ladder, 2 of the best in the platforms mixed together. So you have got 2 of the best things available with you. As I said, this is the plus part, where is subscription based is where we complete the full courses. Full courses we get time where we are taking the full course, where you understand the complete subject, and it is where the teaching properly takes place regarding the subject. And the special classes, as I said before as well, are basically for discussion of MCQs. All right. and where we discuss. And if you're well prepared, you can go ahead with the special classes which are completely free. All right, the question bank regarding that, we've got more than 25,000 plus questions and got good explanations for each of them as well. All right, so this is congratulations to all the toppers who did well in the FMG December exams. So congratulations to all of you. All right, so this is the only platform that we can wish them they were associated with us. All right, the new feature, raise a hand. All right, so in raise a hand, you can ask questions directly. Personalized interaction is there. Straight away questions can be asked in the live class. Okay, that is available with on the app itself. Now, this was about the All India mock test. So we have given you the answers. So AIMT, which was, like today. So you already have the questions and answers. We've already recorded the answers, which you people can go through. So All India mock test was there. And the answers, this is just to tell you guys that answers and the discussions have already been uploaded. So I have finished up uploading all of them. You can go through the answers about the All India mock test, which was held. So the answers are there, and I've given the detailed explanations for the anesthesia questions which have been there. Okay, so you can go through that explanations for the people who have gone through the mock test. Okay, so explanations of all the answers which were there in the All India mock test, you can go through them. All right, they've been recorded. Now, notes for NEET PG is a new introduction which is taking place. And remember, if you want to take a subscription, go ahead fast because the price hike will be coming soon. All right, so these are other things going on in the platform: educated curated test series, study with me YouTube series, various combat which is there. All right, surgery, biochemistry, all these things are there. All right, so they keep on happening. Please see the chart so that you come to know what is going on. All right, these are the various batches which are going to run. So hopefully people who are preparing long term would go ahead and see through it. So NEET PG 2022 previous year question batch. Okay, PYQs, Focus FMG comprehensive batch, complete discussion. Okay, Focus FMG another 22 comprehensive batch, complete discussion is taking place. Target next 2023 subject wise division batch, and there's a new thing coming up called NEET PG 2022 all educators revision batch. Everyone is going to take a class here. It's a new thing. Okay guys, so this was just to tell you all the batches which are coming up. If we don't tell you, then how will you come to know? Okay, so hopefully all you are aware of all the batches which are coming up. The reason is that Unacademy is a huge platform where all our old videos are also got recorded. So the point is, how will you come to know which are the old and the new ones and how to find it? It's a huge pool of information over there. So these are the new batches which are coming up. Keep in mind for people who are preparing. I still can't see any of the messages of all you guys. Okay, so we'll just hold it in the form of polls now. People who haven't followed me up, do follow me up so that you come to know when my next sessions are held on the Unacademy app. Okay, without wasting any more time, I'll just discuss the MCQs with you as what we had thought. Okay, so I wanted to take it in the form of poll and answers, but I can't see any of your any of your messages. I just can't see any of your messages. I can see the people who have logged in, who are joining in, who have joined in, but somehow or the other I'm unable to see any of the message. So maybe the next time around we'll rectify. That is tomorrow. I'm again having a YouTube session tomorrow. First question that we start today is that I'll give you the answer. So bispectral index is indicative of post anesthesia discharge score, post operative pain, adequate muscle relaxation, or none of the above. So I would have liked to hold this in the form of poll where I could have seen, all your responses and maybe then gone ahead with that and discussed it out. Okay, so let me just see it again if I can log in and see your responses. So people do send in your response. Let me just see if I can still manage to see it. I just don't know. Sorry, I just can't see the messages. I just can't see the live messages. I can see myself, but I can't see the live messages. Still trying to search it out, guys. Yes, now I get it. Now I get it. Finally. Good evening, Dr. Duri Ravi Shankar, Dr. Stuffy, everyone. Dr. Shrimi Sethi. Good evening. Now I'm so happy. See, look at my face. All of you, did you see that? Okay, so Dr. Stuffy and Dr. Stephanos Stephanos George, right. Dr. Sushma, Dr. Tejashri, correct. So none of the above is the correct answer. As I said, this is a very important question in every of my sessions that I'm taking. All of you have given me a correct answer. The correct answer is none of the above because the right answer is depth of anesthesia. Okay, so all of you mentioned to me also the correct answer. Okay, Dr. Duri Ravi Shankar says, "Chalo party, sir." Actually, Dr. Ravi Shankar, I was waiting to see your responses. Yeah, till the time responses are not there, even I wasn't getting. There was no, what do you say? I was feeling I'm talking to a board straight away. Now I can see everyone responses and things are fine. This is exactly why the app helps us much more easily. Okay. Anyways, thankfully here also I could connect with all of you and I'm happy for that. So as I was saying, let's continue with the discussion. So post anesthesia discharge score, guys, remember there is something called as Aldrich scoring system. This is again important. Okay. Aldrich scoring system. The whole point is not to discuss about the right answer over here. So once you have taken the options, might as well discuss things out. So post anesthesia discharge score can be seen by the Aldrich system. Okay. Aldrich scoring system. Post-operative pain, guys, you must have heard of something called as visual analog scale, McGill pain questionnaire, or there is something called as CHIOP scale for children. So in adults, VAS score or visual analog scale is the most important scale to see the post-operative pain in adults, while in children, remember C for children and C for CHIOPs. So children's scale is a CHIOP scale. So what they do is, if someone is having pain, you just look and ask the person how much pain you're having, So on a scale of 0 to 10 sort of thing, you would ask a patient how much pain you're feeling. So 0 to 4 is considered as mild pain, 4 to 7 is considered as moderate pain, and 7 to 10 is considered as severe pain. So, based on that, you will ask a patient and finally you will derive as to how much pain the patient is having. So that is a indicative of post-operative pain, visual analog scale. This question also has been asked in exam. Similarly, for children, you've got something called as CHIOP scale, because if you ask any child, how much is the pain, they are not going to quantify how much is the pain, 0 to 4, 4 to 7. So for a child, you might have to look at the child's face, you might have to look at the child's reaction, you might have to look whether the child is able to get consoled or not, the activity of the child. So all those, you have to decide it, being the doctor, okay, the other person, you are the one who will be deciding it. So this is called CHIOP scale. A lot of other things are there. FLACC, FLAC scale also is there. FACES scale is also is there. The most important which has been asked in exam is CHIOP scale. The full form is Children Hospital of East Ontario, Canada pain scale. This pain scale was developed in this hospital, hence it's called Children Hospital of East Ontario, Canada pain scale. Okay, so this is called CHIOPs. That's the full form. Okay. Thumbs up everyone, all okay? Did you understand? Acha, last point, adequate muscle relaxation, guys. Remember, again, very important, neuromuscular monitor. Okay, so all these are MCQ questions, all of them come in exam. So bispectral index basically is for depth of anesthesia monitoring. Okay, for post anesthesia discharge score, Aldrich score becomes important. And for post-operative pain, visual analog scale, CHIOP scale. And for adequate muscle relaxation, you've got the neuromuscular monitor. Okay, so this is what is called as the bispectral index. Remember, I've been telling everyone it can come as an image-based diagram also. No one can predict the questions, but you're supposed to know. Don't think electrodes on forehead means it's wrong. Sir, electrodes were applied at the wrong place. It has happened now once. Someone said in a mock exam that we took, we put an exam like this. They said, sir, you have set up the wrong question. What is the wrong question? The wrong question was showing that electrodes are placed on the forehead. The question is not wrong. You have not studied that point. Okay, that's how questions come in exam. Okay, electrodes on forehead is not wrong. So it was actually told to me by one of the person who was giving the exam. As I said, no, it's not wrong. We didn't show you the wrong question. Okay, so the point is electrodes on forehead. Remember, it's going to see it with EEG. It's going to be EEG based. So this is bispectral index. Okay, electrodes are placed on the forehead because it is the electroencephalogram. It's based on that. And I think all of you gave me the answer between 0 to 100. So I'm not going to go into details. 0 is sort of coma, 100 means awake, in between other values. Okay, so I'm not going to go into a lot of details, but remember, bispectral index is based on EEG and it tells you depth of anesthesia monitoring. How deep is the patient under anesthesia? So electrodes on forehead is not wrong. Okay, so this is bispectral index. And this is what is neuromuscular monitor. Two important questions, guys. Neuromuscular monitor, it's been a while that they haven't asked in exam. Okay, so bispectral index has been asked regularly from 2019 onwards. They've been asking you continuously in all the exams. But neuromuscular monitor, for quite some time, they've not asked. And remember, this question, neuromuscular monitor, is an important question between anesthesia, physiology, and pharmacology. Okay. Dr. Namrata is saying sedation is from 60 to 80. Sort of, Dr. Namrata, since we are discussing, might as well just say that. See, remember 100 for that was awake, 0 was coma. So remember, sort of 45 to 65 is said to be GA and 65 to 85 is said to be sedation. You can call it 60 to 80 also. Sort of, okay. So that's what it is telling you between coma to awake, the numbers. As I was saying, let's talk about the neuromuscular monitor, guys. So neuromuscular monitor, it is to monitor the neuromuscular junction. Okay, so neuromuscular junction, so you're trying to monitor up the muscle relaxation, whether it is adequate or not. Or it is telling you about the muscle paralysis, which muscle is paralyzed or how many receptors are paralyzed or not. It's going to tell you about that. So the most commonest site are the most peripheral available ones. The most common here is the ulnar nerve. As you can see over here, ulnar nerve, neuromuscular. The corresponding muscle is adductor pollicis muscle. Again, this is important question. Okay. So in the neuromuscular monitor, remember neuromuscular, there has to be one nerve. The most common nerve is the ulnar nerve which is used. And the most common muscle is the adductor pollicis muscle. This is what is being monitored. So when you will give stimulus to the ulnar nerve, you will try to see the response in the adductor pollicis muscle. Point is, if some surgeries they are going on where hand is not available, what to do? You can take the facial nerve. Okay. So you can take up the facial nerve and you can see the orbicularis oculi muscle. Okay. In case even this is not available, patient is intubated, then you can take the leg. All right. In the leg, what you can do is look at the posterior tibial nerve and the flexor hallucis brevis muscle. Okay. So most important is the ulnar nerve which has been asked. Rest you can omit. So neuromuscular monitor, the most important nerve is the ulnar nerve. The most important muscle that you will see should be the adductor pollicis muscle corresponding. What happens routinely, guys, is people give 4 stimulus here. 1, 2, 3 and 4. Each of the stimulus is of 2 hertz. Again, MCQ question. All the 4 stimuli are given in a span of 2 seconds. Both are MCQ questions. Okay. Routinely, if there is no paralysis, what will happen? You will get the same response, the same height of response. Okay. This is what is called as train of 4. Train of 4 mode. You give 4 responses. You give 4 stimuli over here at the ulnar nerve. You will get 4 responses over here. All right. In case there is paralysis which has taken place, you will not get a response. All right, because complete muscles are paralyzed. However, when the recovery is taking place from the patient, this is where you will find that in case the recovery has happened with a non-depolarizing, you will get a graph like this. Okay, this is called a fade, which is the hallmark of non-depolarizing muscle relaxants like vecuronium, rocuronium, atracurium, pancuronium, all of them. All right, and in case what you have used is succinylcholine, you are going to get less height. Okay, it will be less but same. So amplitude would be the same. Okay, the height would be shortened. This is seen with succinylcholine, which is depolarizing. Now, one more question. Can succinylcholine show fade? Yes, anyone? Dr. Namrata is saying fade in non-depolarizing. Correct, Dr. Namrata, but I'm asking you, all of you, is normally we know fade is seen with non-depolarizing. So succinylcholine normally is depolarizing, but can succinylcholine show fade? So Dr. George says one answer. Dr. Ravi Shankar says, Dr. Namrata says doses phase 2. Prolonged exposure above 5 mg. Correct, but more than that, I'll rather put it in this manner. Remember, don't remember the doses here. Just remember succinylcholine will show fade, which is called as the phase 2 block of succinylcholine. Correct. All of you have said phase 2 is the correct answer. The normal block of succinylcholine is routinely the phase 1. The normal block is called phase 1. Remember, this is called phase 1 block. It is not phase 1 reaction, which you study in pharmac. Remember, you people get confused here also. It's right. Since we are dealing with it day in and day out, we don't remember, but you know, these small things make a difference. It is a phase 1 block that you are seeing. It's not called a phase 1 reaction. phase 1 reaction is what you study in pharmac, okay, during the metabolism of whatever things are happening with all the drugs. So that is called phase 1 reaction. This is a phase 1 block. So normal block of succinylcholine is phase 1. When it goes into phase 2, this is where you get to see fade, which is the same as non-depolarizing. Okay, so we've discussed this also. This is an important question for the exam. Remember, fade is hallmark of non-depolarizing, but when succinylcholine goes into phase 2 block, this is where you will see fade with succinylcholine. Clear everyone? Thumbs up, all of you. Yes. So fade is normally seen with non-depolarizing, and with succinylcholine you will see decrease amplitude, but the height would be less. Okay, but the same for all the 4 stimuli, it is going to be the same. Acha, thumbs up. Dr. Sushma says thumbs up. Okay, so which of the following is correct regarding information obtained from a pulse oximeter? Okay. Dr. George also says okay. Dr. Ravi Shankar says glass. Dr. Ravi Shankar, glass में बहुत कुछ हो सकता है. There can be many things in the glass, okay? His glass is like this. Dr. Stuffy says, okay. Arey, next answer, all of you. Okay, so there are only 2 answers that I've got till now. 3 people have answered. Other people? So 4 people. Baki ke log kahan hai yaar? There's so many of you. 5 other people. There's so many of you on the chat. I'm just waiting, 30 seconds. Looking at the responses. Okay. Okay, so let's see. Okay, it seems to be an easy question, but how do you get the answer then? All right, so most of you have given me the answers, and it's a confusing. Apart from cardiac output, all of you have mentioned, if I have to see, all of you have mentioned some answer or the other regarding A, regarding C, or regarding D. All right, so the correct answer here is going to be peripheral perfusion. Okay, all of you have marked it A is correct. Peripheral perfusion, apart from cardiac output. Okay, so all of you had given. Now remember, when you speak of pulse oximeter, one has to know what principle is it based on. One more question. Question aaya hai. Kar lu? Guys, may I? One more question. As I said, deriving from the question, before I discuss this point out, what is the principle of the pulse oximeter? Or pulse oximeter is based on which of the following principles? Oh, important ones. Let's write it down fast. Okay, Venturi Principle, Bernoulli's law, Charles' law, none of the above. Let's have 4 of them. Dr. Safi has given one answer. There are 4 options. Venturi Principle, Bernoulli's law, Charles' law, none of the above. So we just did the question, okay? Dr. Sushma gives an answer now. All right. Right. Actually, you know what? The correct point is Dr. Staffy did give the correct answer. Okay? That was the correct answer, hence I changed the answer. Alright, so that's how we change the options in the exam, and do remember, that's why we always say, please go through the previous year's questions, go through all the image-based questions. A lot of repetition of the questions takes place just by changing the option. Actually speaking, at 3rd or 4th option, I was about to give that Beer-Lambert's law. Okay, but since many of you are already aware and you would be knowing if I give Beer-Lambert's law, I tried to change it and just wrote it down as none of the above. Okay, but not always none of the above is correct, guys. Remember this point. Venturi principle and Bernoulli's law is basically for the Venturi devices. Both of them are basically for Venturi mask. In fact, not just Venturi mask, even the nebulizers work on the same principle. Even the suction would work on the same principle. So all this is working on the same Venturi principle of Bernoulli's law. From MCQ point of view, these 2 points are important because Venturi mask is based on that. Venturi mask, okay, the way that you supply oxygen. This Venturi mask, guys, remember, is a fixed output device. In fact, when you classify oxygen delivery devices to a patient, sorry, I'm deviating. May I? All of you, may I deviate slightly? Are yes or no? Which I always do, so that we can discuss a little bit. Are yes? So remember, guys, oxygen delivery devices are low flow and they are high flow. Okay? Oxygen means when your patient comes to the casualty and you're giving oxygen to the patient, what is the first thing you like to put? You normally put an oxygen or a nasal cannula. Okay? So what you're doing is putting up a nasal cannula to the patient or a nasal prongs, which you people must have seen. Nasal prongs or nasal cannula. Okay? After that, you try to put the normal face mask. That face mask is also called a MC face mask. Okay? Which we normally say, but normal face mask is what is given to the patient. Remember, nasal cannula maximum oxygen that you can give is 44%. Face mask can give maximum of up to 60%. So they made a new mask, a face mask with a reservoir bag below. It is got of 2 types. There is something called as partial rebreathing mask with a reservoir bag. It can give up to 70% oxygen. Most important, which was used in COVID, is the non-rebreathing. Thumbs up, guys. This is a question which was asked in the year just after COVID. Non-rebreathing mask is the one which can give maximum 90%. So these are low flow devices, but the maximum oxygen is given by this non-rebreathing mask. It's a face mask with a big reservoir bag below. Okay. And this was the one which was used maximum during COVID. Okay. For all the patients. All right. Now, high flow would be 2 things. Just from that nasal cannula. One is this Venturi mask. Venturi mask becomes high flow. But the only problem is that when you're giving nasal prongs, face mask, rebreathing or non-rebreathing, you can say maximum delivered to the patient is 44, but you don't know whether this much is going or not from the device. Same thing here. You know maximum delivered with non-rebreathing can be 90, but it's question mark whether it will go or not. And that's exactly why Venturi mask was made, because Venturi mask becomes a fixed output device. You know how much exactly is going to the patient. So remember, Venturi has got 2 points, high flow and fixed output. It's based on that Venturi principle or Bernoulli's law. Okay, which is called the law for air entrainment. These are all questions which are important for NEET PG and NICET. Bernoulli's law, air entrainment. So Venturi mask is a fixed output device, high flow device, but problem, the maximum oxygen that can be going from Venturi mask is only 60%. And that is why, guys, in COVID, you must have heard of another name that came up during as a high flow device, which is high flow nasal cannula. It's a nasal cannula, but high flow nasal cannula, which is sort of attached from a ventilator, and this can give up to 100% oxygen. And that is what you people must have seen. A patient not improving with a normal face mask was put on non-rebreathing mask. A patient not improving with normal rebreathing mask was put on high flow nasal cannula. Not improving with that was put on BiPAP and CPAP. Not improving with that, put on ventilator. Now, after that, not improving, the last thing was ECMO, which was given to the patient. This was a sort of oxygen delivery or oxygen management of a patient in COVID. Thumbs up, all of you. Did you understand? That was in short. 1 minute oxygen delivery in short. Hooray, thumbs up, everyone. Sorry for all the things that I've drawn this way, but that's how we normally kind of. Okay. So hopefully people have understood. We are discussing about the Venturi mask here. So Venturi mask, guys, is the one that is based on Bernoulli's law or Venturi principle. Okay. And it is something which is called as the high flow device or fixed output device. All right. Now going back to what we were discussing. So principle of the pulse oximeter, guys, is the Beer-Lambert's law, which is the principle absorption of light, absorption of, okay. You all know that this light is something which is going through the blood vessel. All right. So here is the blood vessel, guys. So normally, how do you come to know that someone's SpO2 is 90%, someone's SpO2 is 95%, 98%? How do you come to know? So basically what happens is, the blood flow is happening in the periphery here. Okay. So there are two kind of lights that get released from the pulse oximeter. You must have seen a light is coming always from pulse oximeter. One is the red and other is the infrared. Okay, so red and the infrared. So one of them absorbs the deoxygenated, other one absorbs the one of them absorbs the oxygenated, goes to the oxygenated hemoglobin, calculates that. The other one deoxygenated hemoglobin, and the difference between them and is what is shown as SpO2. A normal SpO2, guys, is always more than 95%, and that is why during COVID, again, when someone's SpO2 was less than 93, they said go to the hospital. A routine SpO2 should be always more than 95%. Less than 93, you have to question what has happened for 93. Yes, it may be normal in few conditions like COPD. It may be normal in pulmonary fibrosis. Okay, in patients who have chronic cyanosis and all. So in those patients, less saturation will be there, but those are exceptions. A routine patient will always have it more than 95%. So that's the difference coming from oxygenated and deoxygenated hemoglobin. How did that happen? Because the light has gone through the blood vessel, the peripheral blood vessel which is here, and from here it has gone through that oxygenated and deoxygenated hemoglobin, and it was showing it through that. Now the point is, in case your hemoglobin is damaged, it is going to show a wrong reading. And that is why you get a wrong reading in methemoglobinemia or carboxyhemoglobin. You get a wrong reading. Similarly, if someone has applied a nail polish, nail paint, huge amount of light, dyes and varnish, the light going through it will be decreased. So infrared and the red and the infrared light will be decreased. So again, you get wrong readings. But another important point is the blood flow that is taking place. Imagine if someone's blood flow is decreased, you are going to get wrong readings. Therefore, in hypotension, you get wrong readings. Someone's BP is less, shivering, you get wrong readings. Someone is in shock, you will get wrong reading. Patient hypothermia, you get wrong reading because the blood supply here is getting decreased. Therefore, ultimately, you have to remember that the pulse oximeter also tells you whether the perfusion to the periphery is maintained or not. So basically, it's telling you peripheral perfusion. It is just telling you SpO2. It does not tell you about the cardiac output, and it does not tell you about the dissolved oxygen. It is the oxygenated hemoglobin, deoxygenated hemoglobin, and the difference which is shown as SpO2. You can't calculate percentage of hemoglobin deoxygenated directly. It does tells you the SpO2 reading. And because it is based on the blood flow to the periphery, it tells you about the peripheral perfusion of the patient. Because of which you also tend to know the heart rate. Because when the blood supply is coming over here, you tend to know the heart rate or the pulse rate of the patient, how much it is. Thumbs up, everyone. Clear? So the correct answer here is peripheral perfusion. Array, thumbs up, everyone. Is that okay? Did you understand? Hopefully. If I'm wrong, do correct me. Okay. So I think most of you are okay with that. So therefore, just remember, when you see a pulse oximeter reading, it tells you about the SpO2, which is the saturation. It tells you the pulse rate or the heart rate of the patient. Reason is that the blood supply to the periphery is maintained. In case the blood supply gets decreased, even the readings will be wrong. Okay. It is telling you something about, you must have seen this plethysmography graph. So this graph tells you the same thing, that the blood supply is maintained. It's peripheral perfusion. It is telling you about the perfusion happening. It's the plethysmography graph. This is what is called plethysmography. Okay. So these are things that you come to know from a pulse oximeter. सबके घर में आजकल होता है ना pulse oximeter. Everyone is having, yeah. Next question. Coronary steal phenomena is seen with Dr. Namrata says reflectance pulse oximeter. Okay, so Dr. Namrata, especially in athletes and all, what they have done is it's called the reflectance pulse oximeter. Okay, so it is different from this that you are seeing, and it's a new concept which is there, Dr. Namrata. Okay, so that is what is called as reflectance pulse oximeter, especially in athletes. So it is because of the reflection of the light that is going to take place. It is something different. It's not based on the same principle. It is slightly different. Okay. So that is called as reflectance pulse oximeter. There's another thing called as Co-Oxymeter. Again, this is important. Co-Oxymeter is important for methemoglobinemia and carboxyhemoglobin. In these conditions, Co-Oxymeter gives you the correct reading. Co-Oxymeter. But I don't think you people need to know all that. Don't go into so much depth. Let's see this answer. So Dr. Namrata has given the answer isoflurane. Dr. Staffy says D, halothane. Dr. Dawood says B. Dr. Sushma says D, halothane. Correct answer किसी ने नहीं दिया अभी तक. No one has given the correct answer. None of you till now. Of course, Dr. Namrata is right, but that option is not given to you, Dr. Namrata. Good. Now is the answer right. Right. So Dr. Ravi Shankar and Dr. Namrata are now right. It's hydralazine. Just because the question has come from anesthesia doesn't mean. That's exactly why anesthesia questions are always tricky, guys. Remember, anesthesia questions are tricky because they are along with. In fact, anesthesia questions are already getting overlapped with questions from pharmac. They get overlapped with questions from anatomy. They get overlapped with questions from ENT, especially the airway questions. They get questions overlapped, especially with medicine, methemoglobinemia and all. So therefore, many times anesthesia questions seem tricky because they are overlapping with other questions, other branches. Okay. Here the correct answer is hydralazine. Okay. Coronary steal phenomena is basically steal, robbing of blood, stealing blood. So someone is robbing the blood from somewhere. Okay. Which are the drugs which normally do it? So exam point of view, remember isoflurane, as Dr. Namrata initially said, correct answer, but I haven't given it option. But apart from isoflurane, the other two common drugs, lots of drugs are there. The most common drugs which cause them are hydralazine and dipyridamole. Others are also there, by the way. But these are the most common ones asked in the exam. So from anesthesia, isoflurane is there. Others are hydralazine and dipyridamole. So these drugs basically are coronary vasodilator, which is a good thing, not a bad thing, by the way. Problem is, this is problematic in patients who are having a block. For example, this patient here is having a plaque over here. All right. So the area where there is a plaque, this area would become an ischemic area. Ischemic means blood supply is less. So therefore, body tries to increase the blood supply to this area by developing collateral. Okay. So this is the function behind it. For example, let me draw it like this. This is the coronary vessel. And if you get a plaque over here, this area of plaque becomes the ischemic area. This is the normal area. So what the body will do, try to increase the blood supply or increase the blood flow to this ischemic area. What does it do? It develops the collaterals. Okay. So the collaterals get better developed, and in the end what is happening is the normal area that you see, this is going to get less blood supply, and the ischemic area is going to get more blood supply. So can you see? This is the normal area getting less blood supply, and this is the ischemic area which is getting more blood supply. Because all these vessels are already dilated, they are dilated maximally. Because this was the ischemic area, they are dilated maximally so that more blood is present in this area. Because this was the ischemic area, there was a plaque here, this is ischemic area. So can you see the blood is flowing from the normal area to the ischemic area routinely. Then you give drugs like isoflurane, you give drugs like dipyridamole, you give hydralazine. What they do? They cause coronary vasodilation. Because of coronary vasodilation, which means coronary blood vessels get dilated, which means all these blood vessels are getting dilated. So in case let me just change the color. So all these blood vessels are going to get dilated. All of them, all the coronaries are now getting dilated. But the capacity to dilate these normal blood vessels is much more than the capacity to dilate the already dilated blood vessels. So when you give drugs like isoflurane, dipyridamole and hydralazine, so this that you see, the normal area, this becomes more dilated compared to the ischemic area. Therefore, what will happen is that the blood flow, instead of going from the normal to the ischemic area, now starts to flow from here to here. And this is what is called as coronary steal, that the blood is flowing from the ischemic area to the normal area, which can lead to myocardial infarction in a patient. So therefore, this patient was already having a plaque, was already ischemic patient, and can lead to myocardial infarction. This is exactly why isoflurane is a drug of choice in all the cardiac patients. But when it comes to myocardial ischemia, ischemic heart disease, this is where we don't prefer to use isoflurane. And the reason is because of the coronary steal phenomena. It is stealing the blood. This is what is called coronary steal, that is seen with isoflurane, hydrolazine, dipyridamole. Thumbs up, everyone. Clear? Everyone okay? Yes, any questions, doubts till now? Hopefully okay. Okay, so next question, let's take. All right. Well, the thumbs up that I get from you people makes me understand that you people have sort of understood the point. Okay, that's the reason behind it. All right. So thank you. Let's see the next question. So okay, so most of you I find have given me the correct answer, which is A, Miller. Okay, so children are small. What you prefer is a smaller name in them, Miller. Okay, the two most important ones are Miller and Macintosh. So remember, Macintosh is what is used in adults. Miller is what is used in children. Okay, so they can also be asked as image based diagram, important question. So normally this is what is called as a Miller blade. It's the straight blade, and this is used in children. This, the next one that you see, is Macintosh. This is the curved blade. This is used in adults. Okay, this is what is called as the McGill. It's not used anymore. It was the old one. In fact, the first type of laryngoscope which was ever developed. They won't ask you in exam, but it was just to put a name over there. But this won't be asked. Miller and Macintosh are important ones in the exam that you people need to know. This is another special one, which is from anesthesia. This we use basically for difficult intubation. This is called McCoy laryngoscope. So when you press the lever from the back, there's a hinge joint which goes up. Okay, so whenever you press the lever from the back, the hinge joint here goes up. It tries to, yes, Dr. Ravi Shankar says McCoy. Correct. So this is what is called McCoy, that is used for difficult intubation. It's also called a hinge tip blade. It's also called as a hinge tip blade. This is used for difficult intubation. All right. So simple question, laryngoscope. All right. They're important ones. Another point is that when you use, why do you think you have this straight blade and curved blade? What's the reason behind that? So remember, this was a pediatric question which has been asked before, that whenever you use a straight blade, it has been made straight, is because you will, in a children or in a child, you are going to include epiglottis during the laryngoscopy. However, when you do it in adults, the tip of the laryngoscope lies at vallecula. And can you see the epiglottis is free? And by the way, this was a question in NEET PG, in FMG this time around. They'd given you the diagram of this cavity of the oropharynx and larynx, and they'd asked you what is this structure. They had asked you epiglottis. This was the question asked in FMGE this year, December. Epiglottis. You were supposed to identify as an image-based diagram. All right. So when you're doing laryngoscopy in a child, this epiglottis is included inside the laryngoscope. However, in an adult, the epiglottis is left free and the tip of the laryngoscope lies at the vallecula. MCQ question. That is why routinely in adults we prefer to have curved blade. In children we use straight blade, and the reason is the anatomy of the airway of the child and the adult. Both are different from each other. You people know the narrowest part in the child is the subglottic area. In an adult, the normal vocal cord is cylindrical in shape. In a child, you will find it more to be like a cone-shaped structure. That's exactly why in a child we prefer to use uncuffed tubes. All right, and in adults we use cuffed tubes. Thumbs up. Hopefully clear. Easy question. Any doubts, people? Hopefully not. Okay, so let's take the next question. A patient presents in the emergency with shoulder dislocation And which of the following is correct regarding the anesthetic techniques that can be used for the reduction of the shoulder? So Byers block, Caudal block, general anesthesia, all of the above. Dr. Ravi Shankar says, please tell the concept of cuffed and uncuffed. Same thing, na? Uncuffed because you are using, it's a narrow shaped airway in a child, na? That's the only thing. In adults, you are having a straight. So uncuffed is not used in adults because it's a cylindrical shaped airway. Okay. Uncuffed is and used in normally in children because it's a cone shaped airway. It will get stuck on there. Dr. Ravi Shankar. Hopefully that's okay. Okay. So for this answer, some of you have given me the answer A, some of you have given me the answer B. So Byers block, Caudal block. This is an important question. Caudal block. Why am I pointing it out? Just give me a second. Just give me a second. So most of you marked the answer A. Huh? By the way, caudal block is supposed to be below caudal sacrum. It's supposed to be there. It's out of the point. This is not there. Whereas someone staphylococcus is also there. I am streptococcus then. Next time, I said wonderful names you people keep here. Next time I'm going to say my name is streptococcus. Class held by Dr. Streptococcus. So we'll say hello to each other. Dr. Staphylococcus will say yes and I'll say hi, Dr. Streptococcus here. Imagine all of you, सबका नाम कैसा हो जाएगा? कोई बोलेगा I'm COVID, कोई बोलेगा I'm Streptococcus viridans. Someone will say I'm Staphylococcus. Very great yaar, what names, amazing. Remember, imagine all of us having such names. सही यार, मतलब I really loved it. Really love the way that you people keep names. I'm Staphylococcus. I'm Streptococcus. Okay. कोई गोनोरिया भी आ जाएगा फिर बीच में. I'm gonorrhea. I'm gonorrhea. I'm herpes simplex. Imagine from where to where you can reach, yaar. I never thought about it. Imagine. Great. I'm just saying, your name would have been so good, Dr. Staphylococcus. I'm calling you Dr. Staphylococcus. Your parents must have kept such a lovely name for you. Okay, and we would be addressing you by that rather than calling you Staphylococcus. And I'll be saying hi Staphylococcus, you'll say hi Streptococcus. Okay, let's go back. But anyways, nice. Okay, so what we were discussing, coming back to studies here, is Byers block, general anesthesia. If you give an answer, I still understand. However, let me first see who all have marked the answer. None of you have given me the correct answer, by the way. None of you. The correct answer here is GA. If I have to give from the options given to you, it is GA. Had there been given no anesthesia, even that would be fine. But from the options given to you, if I have given Byers block, Caudal block, general anesthesia, all of the above. Here the correct answer is general anesthesia C. Read your options. Now, in case if I have not given all of the above, and I have given the option as no anesthesia, shoulder dislocation, can it be done in emergency without anesthesia? Yes, this could have been the correct answer. Okay, right. If I have given, I'm coming, Dr. Namrata, you have to understand first what things are based on where. Okay, if I've given no anesthesia, that would be correct. So many times people just, move the shoulder and just make it normal. You have seen that. It can happen on its own. That's okay. Shoulder dislocation, even without anesthesia, a lot of people can get it done. So that's okay. If I had given no anesthesia, I'm telling you from the options given to us. Now, in case I have kept an option as interscalene block. Dr. Staffy says infraclavicle block. I am coming, Dr. Staffy. Now wait. If I have given option as interscalene block, in this case, general anesthesia, interscalene both would have been correct. The point is, if I have given anything regarding supraclavicular, infraclavicular, all this would be wrong, and why? So first we need to understand where is shoulder dislocation and where are all the techniques going to work. So first thing is shoulder dislocation means the shoulder has got dislocated somewhere here. somewhere here, somewhere here. The blood supply is all coming from the brachial plexus here. The nerve supply is all coming from here. All right. When you give a brachial plexus block, so brachial plexus block can be given at 4 places. So this is what is a brachial plexus block. So brachial plexus block, when you give it, so all of you know brachial plexus better than me. So if you are given brachial plexus block here, all right, remember in a brachial plexus, the roots are never blocked. So the roots are never blocked in a brach. You can block the cords, divisions and the various branches of it, but you will never block the roots. So once you start giving here high up in the neck, this is called interscalene approach. You come slightly down above the clavicle. This is called supraclavicular approach. You come below the clavicle, it's infraclavicular. You come near the axilla, it's called axillary approach. When you give a brachial plexus block, it's only the interscalene block which can take care of the shoulder pain. The supraclavicular and infraclavicular will not take care of it. Thumbs up. Is this point clear? First of all of you? If you have to do something in the shoulder, it's only interscalene approach of the brachial plexus block which will work. Alright, thumbs up everyone. Is this point clear? First thing before I go forward. Okay, so out of all the brachial plexus blocks which are there, out of all the, in fact, the various approaches, let me put it this way, out of all the approach of the brachial plexus block, it is only the interscalene approach which will ideally, in fact, this might also not work. Even this might not work, guys, remember. Therefore, if you have to give GA is a better option because shoulder is somewhere here, shoulder joint, shoulder dislocation. Supraclavicular, infraclavicular is out. Mostly it is not going to take care of it. It is going to be the interscalene which might work. It might still not work. That's why GA still is a good option. No anesthesia, even that is okay. A lot of people do it. So I'm not denying that as well. But what about the other two options which most of you have marked it correctly? So you need to know caudal anesthesia, guys. Remember, epidural can be given cervical, thoracic, lumbar or sacral. When you give a sacral epidural, this is what is called as caudal anesthesia. यार इन दोनों में क्या correlation है? I mean, this and this has no connection, na? I put something in caudal and I took the level till shoulder. That is called total spine or something like that. Okay, something different. Matlab, that's a complication then. It's not possible. Did you understand? Caudal is not the answer, and caudal is an important question asked in the exam. Caudal anesthesia is a type of epidural which is given in the sacral area, sacral region. Okay, that is caudal anesthesia, basically used for pediatric patients, or it is used for pain management, super specialty of anesthesia. Okay, basically used for that. Ha, Dr. Ravishankar, now coming to Bayer also. Is this okay everyone till here? Did you understand caudal? Now let's go back and see the answer. Why not Bayer's block? So Bayer's block, yes, you are right, is supposed to be for a upper limb and lower limb surgery, that too lasting for up to 1 hour. You're totally right over there. Bayer's block could have been an option. Bayer's block is also what is called as intravenous regional anesthesia. Means you are giving local anesthesia drugs intravenously. Intravenous. Which means local anesthesia drugs are given IV. Only 2 drugs are used. Either you will be using lignocaine or you will be using prilocaine. No other drug is used. Drug contraindicated is bupivacaine because it is the most cardiotoxic. So only 2 drugs, lignocaine or prilocaine. The point is you are going to inject local anesthesia IV. But remember, local anesthesia IV causes local anesthesia toxicity. Thumbs up. MCQ question. I am deviating again. Sorry. Local anesthesia toxicity affects which organ system first? You can mark it as ABCD also. CVS, CNS, musculoskeletal, all of the above. Local anesthesia toxicity. Yes, it's called local anesthesia systemic toxicity also. You can call it like this as well. ABCD. Next MCQ question. Sorry, that's how I take MCQs in my classes also. Huh? One second. Alright, great. I love Dr. Staphylococcus. So Dr. Staphylococcus, Dr. Streptococcus is telling you you're the correct answer. It was only Dr. Staphylococcus till now. Okay, so the correct answer, as most of you have pointed, is not CVS, guys, and it's not musculoskeletal, as Dr. Staphylococcus and then Dr. Staphylococcus. देखो यहाँ मेरे मुंह में Staphylococcus ही रह गया अभी. Dr. Ravi Shankar, I think. He's marked it CNS. Right, so the correct answer is CNS. And this is an important MCQ question. Dr. Namrata says more in CVS. No, it's not more in CVS. LA toxicity, the first organ system that gets affected first in the CNS. This question has been asked in exam. Remember, CNS gets affected before CVS. That's exactly why it starts with circumoral or tongue numbness. It goes and proceeds to ophthalmic symptoms. Then it goes to visual symptoms. After that, you get muscle twitching. After that, you get convulsion. After convulsion, you get apnea. And then you get the cardiac complications of arrhythmia. So therefore, convulsions takes place before arrhythmia in local anesthesia toxicity. Thumbs up, everyone. Okay, so convulsions takes place before arrhythmia, and that is why you will always find CNS. The reason why CNS symptoms occur before CVS, because local anesthesia drugs, they act at the nerve. For these drugs, it's easy to penetrate the blood-brain barrier. Simple. Local anesthesia drug, MCQ question. That is the reason. Okay, they work at the nerve. It's easy for them to penetrate the blood-brain barrier. That's exactly why you get CNS symptoms before the CVS symptoms. That's exactly why you get convulsions before you get the arrhythmias. And that is the reason why bupivacaine is supposed to be the most cardiotoxic, because here you will get arrhythmias at the same time as convulsion. So in bupivacaine, the CVS toxicity occurs at the same time as CNS toxicity, and that's exactly why bupivacaine is most cardiotoxic. Thumbs up. Hopefully you've understood all this. Clear? Hopefully. So now coming back. Sorry, I deviated there. We went and discussed another MCQ. Now let's come back to what we were discussing. Sorry, huh? It's like music. You know, in music it's like this. You must have heard ना, लोग पहले बीच में बजाते हैं, फिर थोड़ा सा उधर deviate करते हैं, then they come back again, फिर लगता है wow मजा आ गया. You know, that's how music works. Indian classical music works the same way. Huh? Sorry, I'm teaching you something about music also. Let's forget that. Okay, but that's how music also works. When music you're playing at one level, one scale. Suddenly you find tabla player, tabla is going at one speed. You find tabla player going somewhere, and they come back again, and we find very good. That's exactly how everything works. You deviate slightly and come back to the original now. Let's come back to the original. So the point what we were discussing was local anesthesia drugs are given IV when you are giving buyer's block. And I just told you that local anesthesia drugs injected IV is going to create toxicity, and that to CNS before the CVS, but both will take place. That's exactly when you're giving a buyer's block, guys, you're going to put a tourniquet over here. Now the point is a tourniquet is kept so that the drug you're injecting IV doesn't go inside the heart. Now a tourniquet is the same tourniquet which you must have seen in ortho. So this is going to work only at this area, arm and the forearm and the hand. It's not going to work here at the shoulder dislocation. Thumbs up everyone. Point clear. Simple. It is supposed to work at the arm, forearm, or not even the complete arm. Even forearm and the hand is the only place where you'll have buyer's block working. And that's exactly why nowadays buyer's block is not used anymore. It is just more for discussion. We don't use buyer's block nowadays, guys. Okay, a shoulder dislocation, buyer's block is not going to help. So in this patient, the best thing would have been from the options given is general anesthesia. Clear everyone? Yes. Hopefully. Okay, so we discussed some questions today. I'll take one more question. Yeah, we'll discuss one more and then we'll come again tomorrow and discuss. All right. So some people had asked me to take the sessions for YouTube and requested me. So I said we'll take it today. Today and tomorrow I've got an off. So tomorrow also I'll try to take another YouTube session. Tomorrow I'll have my special classes also. So people who haven't followed me, do follow me. So let's take this question. Which one of the following produces a conduction block? Let's take this question. So this will be the last one for today that we take, okay? Okay, so I got few answers. All right. So from what I see, 1, 2, 3, 4, 5, 6. Right. So most of you have given me the correct answer, lignocaine. It's the correct answer over here. Conduction block. Why conduction block? So whenever you give local anesthesia, remember you're injecting it inside the tissue. How does it work? In the tissue, there are a lot of nerves. Okay. And basically the whole function is, in case someone has sustained an injury in the tissue, what happens? The injury, that pain is carried by the action potential through the nerves. Okay, the nerves carry this action potential, they take it to the spinal cord. Remember, that's the lateral spinothalamic tract. Then you get A, delta, and C fibers that carry the pain, and from here it goes to the brain. So that is the pain pathway, you know, modulation, perception. Why acetylcholine is there? To confuse you. Simple. There's no reason for options to be there, guys. There's no reason for options to be there. Okay. So conduction block. You know, you have to see which is producing a conduction block. All right. In fact, Dr. Staphylococcus, let me give you another question which was asked in the exam. Okay. Which one of the following, all the following are used during CPR except head tilt, chin lift, jaw thrust, एक था chest compression, and the fourth was given as neck bend, spine twist. Dr. Staphylococcus, that's to answer your question. So this was a question asked in the exam, NEET PG, by the way. At that time when it was called, maybe 5-6 years back, when it was called All India PG entrance exam, there was one question given, except. Okay, so head tilt, chin lift is understood. Jaw thrust is understood. Okay, someone says chest compression, understood. Someone write Heimlich's maneuver, still understood. They can be used. Someone writing neck bend, spine twist does not any sense. Okay, imagine. So this was an option given in the exam, which is not supposed to be the neck bend and spine twist. All right. So sometimes options are given in the exam just to confuse, or for you to know that it's the wrong one out over there. So acetylcholine, that was the reason for that, Dr. Staphylococcus. Anyways, coming back to what we were discussing, I was telling about the injury part, that action potential is the one which carries it, you know, through the nerves to the spinal cord and to the brain. So whenever you, for example, here in the injury, you have to inject lignocaine to take care of pain. So what will you do? Inject it over here. It blocks this action potential from going forward to the brain. And that is exactly this action potential because it is getting blocked, it's called as conduction block. Okay, conduction block because it blocks that conduction, generation and conduction of the action potential. So lignocaine or any local anesthesia drug, what does it do? This will block the generation and conduction of the action potential or impulse, so that the action potential generated because of injury does not reach the brain, because of which whenever you give local anesthesia, guys, it's called as a conduction block. It prevents the conduction from going forward. Clear, everyone? So the correct answer is lignocaine. That's the reason behind it. All right. So succinylcholine, vecuronium are all wrong. Even acetylcholine. It's lignocaine. So thumbs up, everyone. Thank you for joining me at this session. Tomorrow also, I think I'll take YouTube from 5 o'clock onwards, 5 to 6 again tomorrow evening. And tomorrow I'll also try to schedule special classes. I have some time. So people who haven't followed me up, do follow me. Okay, so that you come to know when my next classes are being held. All right. Any questions and doubts, ask me. Otherwise, I'll catch up with all of you tomorrow. So people who haven't downloaded the app, download the Unacademy app, and so that you come to know when our next sessions are held. All of us, in fact. Okay? So thank you, everyone. Dr. Namrata, Dr. Sushma, Dr. Staphylococcus, I love the name. So next time I'll keep Streptococcus. And I'll remember, it will be such a good conversation, you know. All the organisms talking to each other. I'm remembering parasitic organisms also, though I'm from anesthesia. I'm remembering all the parasitic organisms, one after the other. Thinking of who to call whom, you know. So lovely. You've given me something in my brain, you know. It's like, you know, stand-up mein aata hai na, karke. This is the next thing for the stand-up, what to do. Okay? Keep people's names as all the viruses. They imagine what will happen. how parasites are talking to each other. Anyways, thank you guys. Okay, thank you everyone for joining me. All right, thank you. So we'll catch up tomorrow. Take care. All the best. Do well. Bye bye. Dr. Staphylococcus says don't get a nightmare. Yeah, no, not at all. It was just in a joke, yeah, just. It was all in a jest. It was nice. Okay, don't feel bad about it. The whole point was, we don't come across names like that. So it is nice. The point is, I would have loved to call you by your own name, na? What your parents have given you. Must have been a wonderful name. So rather than saying Staphylococcus. Okay. Chalo, take care all of you.